So when starting this project, from a design rationale standpoint, we really wanted to create a femoral nail platform that allowed us to address a wide variety of fractures with one instrument set and two nails that function very similarly. We wanted to make sure that we had included many of the features that are available in many of the intermedullary nailing platforms on the market. We also wanted to take a proven surgery and make it both simple for the surgeon while including all of the available technology that we have today on the market. Indications for the antegrade femoral nail really start with fractures in and around the trochanteric region of the femur, including subtrochanteric fractures with extension up into the trochanteric region, or subtrochanteric fractures that extend distally down toward the midshaft of the femur. We've included screw geometry proximally to address all of these fractures with several different screw types. The nail is also indicated for standard femoral shaft fractures, segmental fractures, open and closed fractures. Some of the technology that we'll talk about a little bit later also make the nail ideal for patients with osteoporotic fractures. The antegrade femoral nail was designed as a trochanteric entry nail. We know that this makes the insertion of the nail easier and is a proven technique for treatment of femoral shaft fractures. We've also designed the geometry of the nail with a lateral valgus bend and an anterior femoral bow that both assists with insertion of the nail as well as matches nicely with most patients' anatomy. Proximally, the nail has multiple screw configurations as well as options for multiple screw types, depending on the type of fracture you're trying to address. We have two holes in a reconstruction pattern that are intended to place screws up through the femoral neck and head for addressing fractures in or near the trochanteric region of the femur. In addition to the two reconstruction holes, we have an antegrade hole that is targeted down toward the lesser trochanter. We also have an oblong transverse hole that can be used in one of four different ways. The transverse hole accepts a 5mm cortical screw, while the reconstruction holes and the antegrade hole accept either a 6.0mm partially threaded screw or a 6.5mm cortical or cancellous screw. Proximally, the two reconstruction holes and the antegrade hole are all threaded, which allow the 6.5mm cortical screw and the 6.5mm threaded cancellous screws, and the 6.5mm cancellous screws to thread into the nail, creating a locked construct proximally, which is nice for patients that have osteoporotic fractures or comminuted fractures. Again, the threading of these two different screws into one hole offers a surgeon multiple options, both with screw types and with hole configurations, to address a wide variety of proximal femoral shaft fractures. The distal aspect of the antegrade femoral nail has three holes, two of which are used for static locking, and an oblong hole is available if dynamic locking of the nail is indicated. One of the pieces of technology that we've included in the antegrade femoral nail is the ability to apply controlled compression at the fracture site using the proximal end of the nail. An oblong hole in the proximal portion of the nail will accept a compression spacer, which can push against one of our transverse screws and allow controlled compression of up to 8mm at the fracture site. This allows the surgeon to apply an appropriate amount of traction without having use force, as we previously did with applying an impactor pad and backslapping a nail out to achieve the same amount of compression in a somewhat uncontrolled fashion. We feel that this is a nice piece of technology and really gives the surgeon the ability to either use the oblong hole in a compression mode or to simply use the oblong hole with a locking transverse screw if this is more appropriate for the fracture that's being treated. As with most antegrade femoral nails, locking end caps are provided in 0, 5, and 10 millimeter increments. We've also included an impinging end cap for use with the 6.0 millimeter partially threaded screws. This allows us to capture the non-threaded screw proximally and prevent its migration laterally.
Okay.
Screw options proximally for the antegrade femoral nail include both fully threaded and partially threaded screws. The partially threaded screw is a 6.0 millimeter screw that has been used many times in a reconstruction mode in previous nail designs. For our design, we elected to offer a 6.5 millimeter fully threaded cortical or fully threaded cancellous screw, both of which can thread into the nail and prevent their lateral migration. The design of the antegrade femoral nail proximally with an oblong transverse hole allowed us to utilize the nail in a few different ways proximally. The transverse hole itself can actually be used in one of 4 different ways. When thinking about the design of the instrumentation for placement of the antegrade femoral nail, we really wanted to make sure that we had instrumentation that was both familiar to the operating surgeon as well as the scrub tech on the back table. We've designed a lightweight radiolucent targeter proximally that can be used for both left and right placed nails. Other things such as captured interlocking screws and reduction instrumentation were also redesigned. We have a new design for a curved reduction tool as well as an obturator that is redesigned that will assist with insertion of the nail. Design rationale behind the retrograde femoral nail was such that we would have a nail that could be placed in a retrograde fashion that would complement our antegrade set. The goal was to provide the ability with one set to treat fractures all the way from the distal tip of the femur up to the trochanteric region of the femur. And the retrograde nail was designed in conjunction with the antegrade nail so that the instrumentation and the approach to femoral shaft fractures would be the same. Indications for the retrograde femoral nail include fractures that start in the intercondylar area of the distal femur and extend all the way up past the shaft of the femur. Indications for the retrograde femoral nail include fractures that start in the intercondylar region of the distal femur and extend up to and even past the midshaft of the femur. In addition to treating metaphyseal type fractures which have routinely been treated with retrograde nails, the design of our retrograde nail allows us to address intercondylar splits that extend down into the knee joint. The retrograde nail was designed in conjunction alongside the antegrade nail so that we could address fractures that started at the proximal end of the femur and extended all the way down to the distal end of the femur. The 2 nails together can really be utilized to handle any fracture of the femoral shaft that may present. Within the retrograde nail platform, we have both a short and a long nail. The short nail is completely targeted and is somewhat of a traditional supracondylar nail in that it was intended to treat somewhat simple supracondylar fractures of the distal femur. The longer nail is targeted proximally but utilizes freehand technique to place the distal screws. This nail is designed more for treatment of midshaft fractures and fractures that extend up toward the subtrochanteric region of the femur. In addition to a standard transverse locking hole, the retrograde nail includes an oblong hole. This hole can be used to accept a transverse screw in a standard static mode, or with the use of a compression spacer, use the hole to achieve up to 7 millimeters of controlled compression at the fracture site. Another feature of the retrograde nail is the use of a condylar nut and washer. These are placed over the proximal transverse interlocking screws and allow for compression of intra-articular fractures that extend down into the knee joint.